Hi, Mia.
Turn one.
We're trying to get Dr. Cook to join here for those of you. How's everybody doing? Today we're going to be talking about facial rejuvenation and laser resurfacing. Unable to join?
Yeah. Something I'm not sure why.
Hello. Aha. Paul.
How you doing?
Hey, good to see you.
Nice to see you as well. How are you?
I'm good. I'm good. It's been a while.
It sure has.
Your Thanksgiving was good?
It was excellent. Were you in
Nice.
town?
What's that?
Were you in town?
No, I was in freezing cold Michigan, actually.
Okay.
Yeah,
Great. With your fiance?
indeed. Yeah, we had a great
Good.
time.
Good. All right. Well, I'm actually very excited. For those of you joining us, Dr. Jonathan Cook is a plastic surgeon in South Florida, and he's an excellent plastic surgeon and an excellent human being, and also really someone who's ahead of the curve when it comes to knowledge regarding lasers. So today, we're going to be talking about facial rejuvenation surgery and combining lasers and skin resurfacing in conjunction with facial aesthetic surgery. So why don't we kick it off with one of the there's many different laser types out there. One of the specific lasers that Dr. Cook and I really love is the Sciton Erbium laser. So let's kick it off with what really, in your opinion, makes the Sciton Erbium laser stand out with respect to other lasers.
Yeah, I think that's a great question. It's a great first place to start, especially for our viewers who are not already in the medical field. I like to use an analogy. I
I
know
love
that
analogies.
Yeah, I know that a lot of us, especially in South Florida, we see a lot of fancy cars, and I think that a car analogy is appropriate. If you look at the build quality of a Sciton laser, uh, it's probably comparable to something like a Rolls Royce, meaning that every single component is not only hand assembled, but meticulously tested. They source the finest materials, the absolute brightest minds in the field, whether it's lasers, whether it's engineering. All of the love and work that goes into every single box is, like I said, comparable to a Rolls Royce. And I know because I've been out to the factory, I've been lucky enough to see these machines as they're assembled, to get to know some of the brilliant minds behind these devices. And that commitment to quality translates through every aspect of the Sciton experience, really. And the end point for that is, well, what's the laser treatment that we're going to do for a particular person? And just one quick, I guess, story about that is I didn't know, but if you ever turn on your laser and you hear it kind of whirring and spinning, I used to think that that was just the fans going, that was like when you start, like the big box computer from the 1990s and the thing has to like, you know, I guess like get ready for
Yeah.
takeoff. What it's actually doing is it's firing the laser internally and
Mhm.
it's calibrating it. It's measuring every single fire from the laser head based on the real world conditions, whether it's the atmospheric pressure, the humidity, all these variables that are like clinically meaningless, but when you're talking about a laser that's precise in microns,
Mhm.
actually makes a big difference. And every single time you turn the laser on, it's doing that. So behind the scenes, what Sciton is doing and accomplishing is a level of precision and technical excellence that is unparalleled.
Right, right. And so I frequently get the question whenever I let a patient know that I think they're a great candidate for laser resurfacing. So commonly, CO2 lasering comes up, and what is your response? Because I'll tell you what my
Yeah.
response is, but I want to hear your response to that first.
So CO2, I guess the answer I give patients is kind of like pulling out the iPhone 7
Hmm.
versus the
That's
whatever we're at, iPhone 16
yeah.
Pro. It gets the job done, and in some ways, it's accomplishing something along the same lines, but it's an inferior product. It gives inferior results. So uh, we can dive into the differences, but I think that the best way to separate those technologies is in terms of heat.
Hmm.
CO2 is a hot laser, and you don't always want that heat, especially in layers of the skin and parts of the face that you really are trying to achieve a result without tightening, without coagulation. But CO2 puts that heat in automatically. You can't turn it off. And in some places, it's good. Around the eyes for some tightening, it's good. That's why our eye doctor, our oculoplastic friends like it so much.
Hmm.
But you can't turn it
Yeah.
off.
Yeah, and we have the ability with the Sciton Erbium laser to mimic that to a very, very precise level with our coag settings.
Exactly.
We're able to do that, and I've just been so happy with the precision of the Sciton laser. So, to the micron, the thickness of this piece of paper, I can tune that laser to depths that we really can't achieve that level of precision with other laser types. We can add other settings in order to mimic CO2 lasers. So it's so funny that you use that analogy. I
Yeah.
use iPhone 16 versus flip phone, so my
Oh,
analogy is
wow.
a little more drastic, but
Yeah.
I don't want to be too harsh on CO2 lasers because for a long time it really was the cutting edge. But I think the technology has evolved quite a bit, and the level of precision and the results that we're able to get with the erbium laser are just truly unparalleled in my objective opinion. Um, so the next topic I kind of want to get into is, you do a lot. You're truly a laser when it you're truly an expert when it comes to lasers. What are some common misconceptions that you find patients have with respect to laser treatments?
Well, I really appreciate and I'm honored for you to use such high praise. I owe a lot of my training and experience to Dr. Jason Posner, who came before me in our field by about 20 years and really championed the use of erbium for full field facial resurfacing.
Mhm.
In the plastic surgical community, without him, we probably would be watching dermatologists use these devices.
Right,
But
right.
in part thanks to him and his enthusiasm, this is still, and I think appropriately, a part of our skill set in
Right.
our toolbox.
And on the same token, he was a great mentor to you, and one of my great mentors was Dr. Jay Burns from Dallas, Texas, also an absolute pillar when it comes
Yeah,
to us all knowing about lasers. So one of my mentors as well that I wanted to mention.
Jay's awesome. He's
Yeah,
a giant in the field.
yeah,
Yeah. So as far as misconceptions about lasers, I think that probably the most frequent misconception I hear is when people refer to a laser as just about anything with an on and off switch in the plastic surgery office.
yeah,
Like, oh, I just had a really great laser. Which one? Oh, it was the microneedling. It's like, well,
yeah,
that wasn't a laser exactly,
right.
but that's just a misconception. As far as like when you talk about actual laser resurfacing, um, people typically have have like an impression that sticks with them if they see anybody go through a full face resurfacing process.
Mhm.
It can look pretty grisly, pretty gnarly. There's a definite downtime to full field laser resurfacing.
Mhm.
That's not always what's necessary. And when we talk about laser resurfacing, that might mean, to use some colorful language, melting your face off,
Mhm.
peeling the layers of skin off. Or it might just mean doing a light fractional, kind of like a polish,
Right.
with very little downtime. And we match, I know you and I, we look critically at the patient's needs and we match the indication with the treatment. And so I think a misconception is, oh, well, I don't want to sign up for something where I'm going to look like, Hellraiser or
Mhm.
something.
Right.
But it's not always like that. It's not always necessary.
Absolutely. Absolutely. And I would echo that as well. There are some patients who, are Fitzpatrick ones who are just very fair and very light skinned and have a tremendous amount of sun damage. Those are patients that we have this conversation and I prepare them, but to really get the degree of correction in those type of patients who are great candidates, we go deep and we go for that really smooth long-term effect, but there's a big recovery involved in that. And
Yeah.
then there's the younger patient who is potentially not quite as light, has a little bit of wrinkling under the eyes. We tune that laser appropriately. So recovery is it's a full spectrum. It can take you a couple months or it can take you a couple days depending on how we tune that laser and how we choose our settings. So that's the wonderful thing about the erbium laser.
Yeah. It's a Swiss Army knife. It's not just a one-stop shop, and that's something which you have to listen to your surgeon, listen to the indication as we are listening to your skin and your needs. It's a conversation, and we try to tailor that result for what you need.
Absolutely. Absolutely. So let's get in a little bit to how how does the laser address fine lines, wrinkles, and skin texture? Can you really sort of, without us getting into the weeds too much, let's go over the basics of how some of those irregularities are corrected.
Yeah, so I think, again, without getting too much in the weeds, uh, really, what are those features that we're trying to fix? And in the skin, for people who are in their mid to late 40s on up, what we're talking about is static wrinkles, meaning features of your face that are present when you're not moving. If you ask a 6-year-old to smile really wide, they will create little wrinklings and folds. Those are not what we're treating with the laser. But if you look at somebody who has etched in lines, these are kind of skin features that result from decades of contracting the muscles and flexing the skin in a way that creates furrows. If you think about it in cross section, it's like peaks and valleys. And what the laser does simply in its most basic sense is it kind of equalizes those peaks and valleys. That's sort of the basic idea, and then we put a little bit of spin on it by addressing things like coagulation for skin contraction, adding energy to try to tighten the skin in select areas.
Great. Couldn't have said it any better.
Nice. You think of it the
Um,
same way?
Absolutely. So it's just I describe it the same way. There's muscles underneath the skin that cause flexion and creases in the skin. And if you take any piece of fabric or anything and over just flex it in the same spot, you're going to get wrinkling and cracks in that fabric, and the skin's no different. So essentially what we're doing is we're leveling off those peaks and filling in those valleys to get more equalization of those of that
Yeah,
undulating pattern. So
yeah. I have a controversial. Uh, do you think that we're tightening the skin when we put some coag in?
clinically, I mean there's a very fine line to the degree of tightening that you can get, but I do. I
Yeah.
really do. I especially as it relates to lower eyelids, because you know, I've seen instances where people smile and they have a lot of skin redundancy there. And I'm very conservative when it comes to lower blepharoplasty. I rarely remove skin unless it's very much needed.
Yeah. Yeah.
The lower eyelid really can't tolerate a lot of skin removal, or else we get changes in lid shape, changes in lid position, and you know,
Mhm.
it's, from an aesthetic standpoint, that's just not acceptable.
No, it can look terrible.
Yeah.
Yeah.
So the laser, you know, I've had patients with so much skin redundancy, and I've seen instances where it's almost completely eradicated. So I never put a knife to their skin. Where did all that skin go? So it obviously tightened up, and you know, I've had instances where I've had temporary, very minor lid retraction, and that's just from skin tightening. It all resolves
Hmm.
100% of the time. But initially, when you see that, it's very, very impressive.
For for those of our viewers who are interested in some of the science behind this, I think I completely agree with you in the areas of the face where the skin is the thinnest, so upper and lower eyelids, because that energy that's causing the skin tightening can only work on skin that's thin enough where we're creating a full thickness effect.
Hmm.
If you're looking at a block of skin, you know, for those of our non-medical viewers, the thickest skin on your body is probably like the palms and soles of your feet and maybe the back.
Hmm.
But the thickest skin on your face is around the mouth, upper and lower lip and down to your chin. So if you're going to try to tighten that skin and affect the full thickness, it's like you're trying to move this incredibly thick piece of skin closer to itself. It's not going to work. Around the eyelids, around the, you know, upper and lower eyelids where the thin is so much thinner, I think you're creating a qualitative change. You're actually changing the skin itself. You're creating this injury that's remodeled in a way that actually does shrink the skin. I think this is in the eyelids something where, you know, we've pretty much hit the nail on the head. If we could do this in the rest of the face,
Yeah.
then it might change our
It
practices.
it's kind of like the holy grail. It's everything we're searching for,
Yeah.
but we're not there yet. We're
No.
not there yet. And I think we both agree that you know, trying to get that tightening around the mouth by using coag and producing heat, it's proven to not be a good idea. So I think that's something we both agree on.
Yeah, totally.
Um, let's get into the surgical side of things a little bit in conjunction with laser.
Nice.
Um, is that a question that you get commonly?
Yeah, and I think it's an interesting question. Like, um, when you look back at, you know, where laser and surgery, they kind of evolved separately. I think that, you know, even when I was taking the boards, even as I help, you know, now some of my friends who are coming through taking their plastic surgery boards, there's this kind of hesitation to combine surgery and laser. And I guess it comes from a place of trying to be safe, but I do have to say I think it's overly conservative.
Hmm.
You know,
Yeah.
the laser that that we're doing, the laser application in facial rejuvenation, is something that really addresses a different layer of skin altogether, and it doesn't jeopardize any of the outcome. And frankly, I think it looks really, really good. What's your experience been?
Yeah, I completely agree. So the concern, it's very common for patients who are seeking facial rejuvenation. You know, surgery most of the time addresses contour.
Hmm.
So, for example, as we age, you know, our framework more or less stays pretty consistent. Our bony skeleton, yeah, we have some changes in our bony skeleton as we age, but usually that's pretty minimal.
Yeah.
What happens is we get sagging of tissues around that framework. So, for instance, the cheek begins to drop, and you know the downstream effect of that is a heavy nasolabial fold and jowling, and so all of a sudden the contour of the mandible is not as sharp and defined as it once was. the neck begins to, tissues begin to protrude forward, and so we can't really appreciate that nice contour of the jawline and the neck, that cervical mental angle that makes people look at yours. I mean, wow, what an example.
Yeah,
But that contour, that definition that makes people look vibrant and youthful, that's an issue of repositioning tissues.
right.
So a laser, we're not there yet for lasers to do that. So that requires some very meticulous, very well thought out surgical planning. Um, and that's a very, very big part of my practice and truly one of my greatest passions. But I always tell patients that we're going to fix that contour. We're going to reposition those tissues. We're going to get that definition to the neckline, the jawline. We're going to get that um, cheek mound back where it needs to be. But I can't polish the surface of the skin with a facelift. That's an exterior
I
thing. Um,
I want to interrupt you. I love that language that you used
mhm,
because I think even at its most extreme, the melt your face off Hellraiser laser, we are only skin deep. It's
exactly.
really where surgical takes it to that next level of altering and addressing the architecture of the face as it ages.
Exactly. And I think that, um, it's it's a little bit incongruent to have this beautiful polished exterior skin without the appropriate contour.
Yeah,
To have that beautiful polished skin, but to have jowling and a lot of laxity and a heavy nasolabial fold, there's a bit of incongruency, and aesthetically that can look a little bit odd. And vice versa. If you've got this beautiful contour to the jawline, the neckline, the cheeks look great, but the skin is just sun damaged and we've got a lot of fine lines. We haven't really finished the job. So
yeah.
the concern, as you know very well, the concern in the past is that, tissue layers um in the face are very important for blood supply. So in a facelift, we would lift the skin and then get under a deeper layer, and then really the bulk of our work is done in that deeper layer. So this area of skin that's by itself, we're always concerned about that blood supply. We want that skin to survive. And now that we've lifted it off of its bed, it's relying on blood supply from another area, from an axial area. And so to insult it again or hit it again on its surface with a laser has always been very concerning for us. I've had this conversation with you many, many times about what our settings are on skin only.
Yeah.
Once we get back to that composite layer where skin is attached to the underlying tissue, we can dial up the settings even more.
Right.
The beauty of facelifting is we're constantly evolving, and there's a trend towards more and more limiting that skin dissection and immediately getting into the deep plane. So that skin is very well nourished and it's got a great blood supply. And because of that, we're really able to be more aggressive about doing our surface treatments with the laser, with having that composite layer. So I think for me in my practice, that's I've seen wonderful benefits in the contour and healing time when it with a deep plane composite layered facelift
This is
versus
the deep plane facelift. This right here that you're describing, this is the deep plane facelift that everyone's talking about.
this is it. This is it. So
Amazing.
yeah.
I don't think there's any topic that's hotter right now in facelift surgery, and you're at the forefront of a conversation that has kind of been, I guess, evolving and going on ever since I came into plastic surgery that I've been with, so at least almost 10 years now. And that is that the advantage of looking at the face as layers
Mhm.
and approaching rejuvenating the face from the deepest layer
Mhm.
and all of the benefits that that gives you, some of which you just very eloquently described in terms of blood supply, in terms of safety, and in terms of the power of what you're accomplishing.
Yeah.
Um, yeah, it's really, really cool.
It is, and we can't we're always looking for ways to do things better, and the moment you begin to think you've got it all figured out is, you're in this field in our profession. We've constantly got to be looking for ways to do things better, give our patients better results, minimize downtime. So it's a constant. We're constantly evolving.
Do you feel like there's any difference in recovery time from a deep plane facelift versus the more superficial facelift or the, SMAS, placation, these kinds of things?
I do. I actually think that patients heal quicker with a deep plane facelift.
Hmm.
When we separate that skin from the underlying tissue in um, more of a layered approach, like I think some people now are calling it a dual plane
Yeah.
approach, that, that skin, in my experience, doesn't recover quite as quickly because it's really trying to derive its nourishment and blood supply from more of an axial
Hmm.
um, uh, territory versus having that blood supply come from underneath from its bed. So I've seen quicker healing with deep plane facelift. That has been my experience. When it comes to necks, it really depends on every patient's different. It really depends on what's necessary in the neck, but I've seen a lot of variability there. But with respect to the face, I've been very, very happy.
When we talk about tuning our laser settings, we've talked about basically every different patient that we encounter. We're setting the lasers slightly differently. Do you feel like you're doing a different surgical technique for every patient that you come across?
Absolutely. I think, you can generalize and kind of classify your approach to facial rejuvenation surgery, whether you do a deep plane, a high SMAS, a SMAS placation. But within those individual techniques, the procedure has to be very, very tailor-made
Yeah.
to each individual patient, and how much aging that person's showing, where they're showing their aging, and to what degree. So it's a very, very targeted, precise approach to each individual patient.
Yeah, I do a lot of, as you know, a lot of breast and body surgery these days.
Hmm.
And I've started to gain some insight into the concept that you're doing the same surgery in some ways,
Hmm.
but it's also different for every single
Oh,
patient.
absolutely.
The anatomic needs, the particular aesthetic concern that they have, the result that they want, all of these things are variables that you can't just cookie cutter approach and
Yeah.
just set it, forget it. You've got to dial into the patient's wants, the patient's needs, and then what you can
Hmm.
safely accomplish.
Yeah. Yeah. So we have this discussion all the time. So a deep plane facelift in my hands is going to be different than a deep plane facelift in your hands. That it just it that's there's so much variability from each individual
Yeah,
surgeon. That doesn't necessarily make one better than the other. It's just it's two different chefs.
I like that. I like that. Cooking
So
the same recipe two different ways.
that's right. That's right. So one of the questions that we frequently get is what is the downtime to laser resurfacing? It's a very generalized question, and how is that typically managed? So I'll kind of let you run with that one, and I'll add my 2 cents.
Yeah, so let me start again by just pointing out that when we talk about laser resurfacing, this is sort of like saying, what's the downtime after plastic surgery? There is just so much that is encompassed by that term. But just for the sake of this conversation, we'll assume laser resurfacing is full field head, top of the face to the bottom of the face, full field resurfacing. So the melt your face off laser. And I think it's probably most appropriate for people to think of that as a 3 month recovery. And uh, it's going to be 3 months until you look and feel normal as you would every day without having thought about having had a laser.
Right.
And that's a long time. Um, Along the way, it's not like you're going to be um, looking like a monster. Your skin's going to be melting off that entire 3 months. But into the second month, most people will still have some residual artifact of having had a procedure. Now, we balance that kind of long tail of effect from the laser. Things like pigmentation, things like redness. We accept that. We tolerate that because all of the good stuff that's happening from that laser is there basically from the first week, and that is an incredibly powerful smoothing of the skin texture. In some cases, right out the gate, you see that beautiful tightening of the lower eyelid skin. There's an incredible, almost like a polish that you can achieve. And anybody who has sun damage, a lot of that is just polished away instantly. A lot of people who have, what we call in the medical field solar elastosis, or that kind of crepey, wrinkly, like something about Mary skin, all of that gets cleaned up right away. You just deal with the aftermath for months.
Mm-hmm.
So I say 3 months, but the real, like, immediate regret period is about a week to 2 weeks.
Mm-hmm.
And that's where I try to be super clear with people. Like,
Yeah.
I will show them on my phone, like, I will swipe the day to day, healing diary
Mm-hmm.
of whoever my most recent patient is. And I will make sure they understand, like, they are not going to be able to go to the grocery store. You,
Yeah.
you will scare people.
Mm-hmm.
Someone will call the police. Like, it will not be good. So you've got to plan your life around that initial two
Yeah.
weeks. After that, you can get away. People may glance at you. You maybe have a sunburn or whatever. But the real downtime, the social downtime, is about, let's just say, like 10 to 14 days.
Right. I completely agree. I tell patients that you are going to be raw for 10 days.
Yeah.
After that, potentially you'll be raw for 2 weeks. This is a full field aggressive erbium laser resurfacing we're discussing right now. Um, After that, you will no longer be raw. That tissue will not be wet and raw, but you will be very red and very pink, and that will gradually fade over weeks to
Right.
months, depending on how aggressive we are with the laser. So,
Right.
yeah.
Right. And it's a process that I think if you prepare for and you anticipate, it's actually not all that bad. It's
Yeah,
when people have, for whatever reason, a mismatch in their expectations.
yeah,
Um, for all of Dr. Jason Posner's uh, good qualities, one of the things I don't think he did very well was set people's expectations to anticipate the whole recovery. And so
yeah.
people, he would say things like, you'll be fine in a week, which for him meant that, he's out of, the patient is out of his
Imme-
surgical office
yeah,
in a week.
immediate. Yeah,
But
yeah,
that doesn't mean that you're through it. So
yeah,
I think people sometimes had a little bit of a shock. But
yeah,
if you know what you're getting into, you're going to need to put down like an old pillowcase for the Aquaphor to get
yeah,
on.
yeah.
But that's not a hardship. That doesn't really like change your life. And the results, I'm telling you, as you know, for our viewers, every single patient at the end of the journey is like, yeah, this was
Yeah,
this was amazing.
yeah, yeah.
This totally makes sense.
Absolutely. It's interesting. I tell patients the same thing for a facelift. I, the common conversation that I have is for 2 weeks, we need you to really take it easy. That doesn't mean you're in bed, but it means you're just at home, taking it easy, watching TV, reading, relaxing. At 6 weeks, you can get back to doing whatever you want within reason. I mean, if someone's into acrobatics or really aggressive yoga where they're moving their neck in a lot of extreme ways, obviously that's, common sense that we want to ease into
Yeah.
that. But in general, 2 weeks of taking it easy. At 6 weeks, you're back to all normal activity, and from 2 weeks to 6 weeks, it's a slow progression back into those things. And I tell them, you're not going to love the way you look and say, gosh, I'm so happy I did this until 3 months.
Yeah.
And that's truly the time it takes for the laser, I believe as well. So interesting, very much in agreement there.
Yeah. That's one of the reasons why laser and surgery play so well together.
That's right. Um, one of the questions we had was combining fat grafting with lasering and facial rejuvenation. Something that I do very frequently. I'm pretty sure you do the same thing as well,
Yeah.
Jonathan. Uh, Another question was if you've had filler in the past. So patients who've had filler in the past and then want to get fat grafting, it's totally okay to do. I do find that those patients tend to hold on to swelling for a lot longer. Depending on how much filler you've had, if you've had a tremendous amount of filler prior, we're probably going to do some dissolving,
Yeah.
just to get a true appreciation of the architecture and framework of the face. So those are not things that um, preclude you from having facial rejuvenation surgery. So do you have anything to add to that?
I think that's a great question, and a very frequent question is people who have had, whether it's hyaluronic acid filler or some of the biostimulatory fillers, your Sculptra, your Radiesse. Is there anything different that you need to do or need to think of as a patient? And you sort of address the hyaluronic acid side. If someone's very overfilled, it might be necessary to dissolve that. But do you approach your patients with like a lot of Sculptra or Radiesse differently on the lead into surgery?
I love to know about it if it's there because Sculptra for me personally, doing the dissection, I haven't found it to be something that really causes confusion during the dissection. Radiesse is a great product. I love it on bone. But when it gets into the tissues, it can cause a little bit of confusion. It's white. It tends to look like um, structures.
Yeah.
Sometimes it can be stringy and look like a nerve, which is obviously something that gets concerning. But there's ways to figure out what's Sculptra and what's not. For me personally, that's been something that when I see, I always, I know there's going to be a little bit of extra work to figure out to navigate around that. But nowadays, we're kind of at a time where anyone who's having a facelift has almost inevitably had some filler, some, sort of thread or some attempt to have a minimally invasive result, which sometimes can be great, but oftentimes truly fails, which is why patients opt for facial rejuvenation
Well
surgery.
said. Well said.
One of the questions we have is when should someone opt for erbium laser in place of a surgical procedure? So, as Dr. Cook and I mentioned earlier on in the stream, is that a facelift and surgery will address contour. So if you've got laxity and your mandible is no longer well defined and you don't have good neck definition anymore, and the cheek is sagging and you've got a heavy nasolabial fold, those are not things that are going to be corrected by a laser. That's a biomechanical thing. We need to get in there and really reposition those tissues and restore contour to the face. The laser is that overlying polish. So if you've got fine lines, wrinkles, sun damage, and your skin's just not looking as beautiful as it once did, or your that luster is gone. Your Those are the types of things that I believe laser will help tremendously with. But what it will not do is address sagging contour.
Yeah, totally agree. Fine lines around the mouth, or around the lower eyelids, textural issues. If you have the term I used before was static lines, things like these in the forehead that are
Why do you
just
have
there.
those?
I raise my eyebrows a lot. Those are the kinds of things that you can polish out
Mhm.
with a full field laser.
Great. great.
Yeah.
Well, let's see if we've got any other immediate questions. Anything else you want to touch on, Dr. Cook?
One of the things that you and I briefly talked about before this call was what patients should kind of know before and after the procedures. I think we've kind of done a good job of setting people's expectations, but I want to hit that point again. If you're at all considering any of these procedures, ask us, ask the questions, get as clear a picture as you can of what your life is going to be like, because that's really what the investment is in the short term, is how will you be required to help maintain or to protect the laser or surgical result that we're all working so hard to
Right.
achieve. And I think that's when outcomes are the best, is when you get people who have insight into what they're getting into and they're motivated to help achieve the best result possible. And when everyone is on the same page, that's where really there's like that synergy,
Yeah.
and the outcomes are just exceptional.
I love it. I love it. Yeah. So, when it comes to facial rejuvenation surgery or any plastic surgery for that matter, it is very much a relationship. Like we are working very hard, uh, genuinely, to get our patients the best result possible, because ultimately there's no greater satisfaction for us to have that beautiful result and see a patient energized and
Yeah,
vibrant again, and really elevating the quality of life again. I mean, genuinely, that's what we're in it for. Um,
100%.
but getting to that end point, really, it's a relationship. It requires a lot of discussion beforehand, a lot of expectation setting, and we're not miracle workers, but we're going to do our best to get a miracle, and we'll inevitably fall short, but that falling short is always, almost always, when there's good communication, the high probability for a beautiful result. So,
Absolutely. Well
yeah.
said.
All
Cool.
right, my man.
All right.
Well, that was great.
This,
And
this was
if you
fun.
have nothing more to add, I think we've covered a lot, and I think that was very educational and insightful for many of our patients. So it was great seeing you, and
Great to see you
hopefully,
too, man.
yeah, hopefully we'll get to catch up in person again soon.
We'll look forward to it. In the meantime, happy holidays to you and yours. And yeah,
Likewise.
we'll talk again soon. All
Likewise.
right, Paul.
Talk to you soon, man. Take
Take care,
care.
buddy.
Bye bye.
Bye.